travel, and of course it was a very scary thing for a lot of people. The picture on the right there is a picture of the United Nations. Based on this outbreak and some others, the United Nations passed a new form of the International Health Regulations back in 2005 that required countries to report these sorts of things and to work together to help contain them. And then in the bottom of this slide, there was a summary of the H1N1 outbreak. And I think we really saw a big difference after the international health regulations were established in our response and the global cooperation for the response to H1N1. And you know, this was a much larger outbreak. It affected many, many more people. The proportion of people who died wasn't quite as large, but it still had a large number of deaths. And as you recall, the deaths were a lot in not the young and the elderly, the very young and the elderly, like flu epidemics usually, annual flu usually affects, but in sort of younger, working age people, pregnant women, and some other groups. So that was it's sort of a very scary thing. Hope you've all gotten your flu shots, by the way. So the world is changing, and the risks for public health increase with those changes. There's a lot of work that still needs to be done in infectious diseases. This is a picture of the AIDS conference last year. There's a lot of progress in some of these infectious disease areas, but still a long way to go. The President's Emergency Plan for AIDS Relief is a United States government initiative to put people all around the world on treatment for HIV. Over 4 million people have been put on treatment, and it's really a game-changing thing that's happened in the world. You travel to countries in Africa where there were funerals every day, and children were orphaned, and now people really have a chance of living and being healthy for a long period of time. It's made a huge, huge difference. Still, though, only about half of the people in the world are getting the treatment that they need who are HIV infected. This is a graph that shows on the y-axis shows the number of cases, and on the x-axis it's dates. The blue bars are the number of cases, and the red line is the case fatality rate, so the percent of people who get the disease who actually die. And this is from the cholera cases in Haiti. And just to tell you, this is just an example of diseases that have been around for a long time but showed up in a new place. So Haiti did not have cholera, and actually cholera had been eliminated from this part, from the Americas, from the Western Hemisphere for a long time, and was reintroduced after the earthquake. It was introduced to Haiti after the earthquake, and CDC has been very involved in the response. So the number of cases has gone down quite a bit. There's occasionally some blips in the case fatality rate, but I think they've made remarkable progress, and feel good about the care that people are getting and the systems that have been set up to address cholera. The problem is that in order to really eradicate cholera, we know that the only way to do that is to improve the water and sanitation systems. And that's a much, much bigger, more difficult, and long-term issue than just treating cholera cases. So they think that really to make a difference in Haiti in water and sanitation, it would take over $2 billion. And so a lot of people working now trying to figure out if there's a way for the global community not to forget that all that's happened to Haiti, and to go ahead and make a really big difference now that could last a really long time. A huge impact for the future to have clean water in Haiti. Finally, here's an example of diseases that pop up now and then. So this is Ebola in Uganda. The good news is that because of some of the work that the U.S. government and others are doing with laboratory capacity building and other types of responses, that these cases can be detected more quickly within the country where they start, and then they can be responded to very quickly to prevent the spread. So I think we're making a lot of progress in this area. Still a long way to go. A little bit about polio. Polio is an old disease that's been around for a long time, and we really do have the opportunity and the challenge to try to eradicate this disease. There's been huge progress in the last number of years with polio campaigns and reducing the number of cases. So just for an example, back in 1998, not so long ago, there were over 350,000 cases in 125 countries. And now we're down to 4 endemic countries, and actually it's really down to 3. India is 1 year with no polio cases, and really did a tremendous job to get rid of polio. The problem is that the 3 countries that are left are Nigeria, Pakistan, and Afghanistan. And as you can imagine, there's a few challenges in those countries. There's issues of the rural population's inaccessibility for the campaigns. There's issues of violence and safety of the workers. In Pakistan, a couple workers working in immunization who have actually been killed. And then there's people, mistrust of the government and thinking that there's malicious intent in the vaccination campaign. So a lot of challenges. And CDC and the Gates Foundation and UNICEF and Rotary and others are working really hard to try to go ahead and eradicate. Dr. Frieden always says eradication is forever and for everyone. So if you can eradicate it now, you can get rid of it forever, and then we don't have to worry about it anymore. CDC was very involved in the smallpox eradication, and we're trying to apply those lessons learned to polio. The other thing I thought I would mention is that this is a projection of the change in population in different parts of the world between now and 2100. It's sort of hard to think about 2100, but so as you can see, Africa is projected to have large population increases, and with some much smaller increases in other parts of the world, and actually Europe is decreasing in population. So the idea here, though, is that if we don't address the health issues in Africa now, they're going to just be amplified when the population gets bigger. So it's best if we can do more now and then have a healthier population as we go forward. So I want to talk a little bit about non-communicable diseases. As a world and a health community, we've actually done pretty well with addressing childhood mortality. If you can look at the light blue line that's going down, so it shows the 0 to 4 mortality, and you can see that it's actually gone down quite a bit. So we've done a lot to really help prevent deaths in young children. If you look at the over 60 line and also the green line, which is the 15 to 59, the deaths in these groups are going way up. And so really what this shows is that over time that the types of things that cause illness and death in young children, infectious diseases, nutrition, those things we've been able to address. But the things that cause death and illness in the elder age groups, injury, chronic diseases, those sorts of things are going to go up unless we can address these things as well. So non-communicable diseases and injury are actually a huge burden of disease in the world. We talk about cardiovascular disease and stroke, obesity, diabetes, chronic respiratory disease, cancers, and injury. The top picture shows a motor vehicle accident. Risk to travelers overseas is the highest risk is actually motor vehicle accidents, not getting an infectious disease. So that's a very important risk factor. The tobacco use is really going up throughout the world. High blood pressure is going up quite a bit. Physical activity is going down. The people are walking less and less and having more sedentary lifestyles throughout the world. Diet, as I showed you on the McDonald's picture, is not getting better. It's getting worse. And then alcohol use is also a risk factor. This shows the main causes of death. This is the last time we have good data from WHO, but I think it illustrates the same thing. About a third of the deaths are communicable diseases and nutritional things, the things that we're traditionally worried about in global health. But 2/3 of deaths worldwide are from chronic diseases and injuries. So we can't just focus on the communicable diseases and think we're going to have an impact on the causes of death. We need to focus on the others as well. This graph shows in blue the deaths in different countries from communicable diseases, and in orange the deaths from chronic diseases, and then the light blue is from injuries. And what I wanted to show you here is that in many, many countries, in really all the countries but the African ones here, chronic diseases are much higher than communicable diseases, as you would imagine. But look at the rate of chronic diseases in Nigeria and Tanzania. They're also quite high. So it's not that these countries are actually facing dual epidemics. They have a high rate of infectious diseases, but also a really high rate of non-communicable diseases. And we can't sort of take care of the infectious diseases now and then worry about the communicable diseases later. We really need to address the dual epidemics at the same time. And this just shows, this is complicated, but if you basically look at the gray bar at the bottom and the white bar at the bottom are infectious diseases, and in low-income countries you can see that there's still a substantial amount of that. But the orange and the ones on top of the orange bar are all non-communicable diseases, and those are increasing over time in high-income, middle-income, and in low-income countries. So finally, I just want to mention about country ownership and sustainability. There's a huge, huge increase in the amount of aid that's provided for global health throughout the world. You can see this graph is just from 1990 till 2011, and the amount of aid has increased tremendously. Also, the number of people that are involved, the different organizations that are involved in global health aid is quite high. So you'd think there'd be plenty of money to take care of all the problems that are out there. The problem is that there's too many players out there, and sometimes these partners don't always coordinate very well. Sometimes they have their own priorities that may not be the country priorities. Sometimes the countries take the money from the donor and then they don't actually invest in that same problem. They just supplant the money in their budget and use their money for something else, so it's not actually increasing the help that is for that particular problem. Sometimes the donors and the different groups do the work instead of helping the countries learn how to do the work. And then there's even the fact that different donors have different reporting requirements, different administrative requirements, and so the countries can spend all their time reporting and doing applications and not actually doing the work. So I think it's really important, as even though there's so much more money going now to really think about, and the donors are thinking about this, how we transition to making sure that the country is driving this and the country has ownership of this. So here's just a little graphic to show what we talk about in the U.S. government, which is over time, we want the U.S. government role to go down, and we want the country role to go up. So we want the country to the U.S. government might start out doing the actual implementation, running the programs, for example, but over time we want to build the capacity of the country staff to be able to do the work, plan the work, and over time actually take over financial responsibility for the work. And that, of course, is going to take a lot longer in some countries than others, but having the financial commitment from the government is an important way to show their investment and their commitment to public health. So I just wanted to say that Global Health Action is working in Haiti and in China and other places, really building country capacity to address many of the challenges that I've talked about today. And want to commend all of you for your support as donors and other supporters, and how critical your support is for the work that Global Health Action is doing. And that through your support, Global Health Action was really able to reach people in need, but also play a big part in having a lasting impact through improving country capacity. So thank you very much.